YouTube video creator and basketball sensation Tristan Jass announced that he's going to have brain surgery to remove a cyst in his right temporal lobe, which was first discovered in 2019 after he had a seizure, but grew slowly over several years on subsequent MRI scans, and in 2025 was found to have an abnormal signal, prompting his neurosurgeon to recommend removal. My name is Beaber. I'm a neurologist in Los Angeles, and I'm going to talk about Tristan's situation and review his MRI scans in detail, but I only know the details he posted publicly online and could only review single images of his MRI scans, so please take this as general information, which I hope is informative, and speculation about different possibilities rather than talking about his own personal situation. So Tristan Jass is a 25-year-old basketball player and video creator, and he's perhaps best known for his trick shots and intricate dribbling and entertaining videos, but he's also got legitimate athleticism and skills, which are evident if you watch his videos, and he even briefly played for a professional team in Vancouver. And Tristan is generally young and healthy and has never had any kind of surgery, but in 2019 he was getting dressed and he had a seizure, which was witnessed by his girlfriend, and he woke up later on in the hospital with his family all around him. And as a routine test after someone has a seizure, he had an MRI scan which revealed a cyst in his right temporal lobe, and this is a routine study after someone has a seizure. Now, they're all different types of seizures. When people think of seizures, they usually think of generalized tonic-clonic seizures. A seizure is caused by spread of electrical activity over the surface of the brain, and when it goes throughout the entire brain, when it's generalized, it gets into the motor areas, so people convulse and also lose consciousness. And this is very taxing on the brain. It depletes the energy of the neurons, so it's common for people to lose time and have a post-ictal state where they're very confused, often for hours, waking up in the hospital and being amnestic for the event, which appears to be what happened with Tristan. Now, when someone has a focal injury, like a tumor or a cyst, they may actually have seizures that are caused by the lesion. But these seizures are often focal in onset and may cause different symptoms. So seizures originating from the temporal lobe could cause vague symptoms like confusion, or people may have symptoms like a sense of rising warmth in the body, or they may have a distinct sensation that's difficult to describe, a sort of deja vu. People can say, that's the exact feeling I get when I'm having a seizure. And people may be confused and have some abnormal movements which could be subtle, known as automatisms. People may have fluttering of the eyelids or fumbling of the hands, and that could be missed by the casual observer or misinterpreted as a purposeful movement. And some people can have these partial seizures, and they can be simple partial seizures, meaning the person is fully alert, or complex partial seizures, meaning there's some confusion, or they may spread throughout the entire surface of the brain and turn into a generalized seizure. So it's possible someone could stare off into space, have some fumbling of the lip, and then have a generalized seizure where they convulse, bite their tongue, lose consciousness, foam at the mouth, and become confused for several hours. But it's reported that Tristan essentially had a generalized seizure. There was no reported initial focal seizure or aura or warning that a seizure was going to occur. And because of this, apparently the doctors judged that the seizure was not related to the MRI finding. And this makes a lot of sense based on the way he describes it. There was no focal symptom, and his girlfriend was there at the time and potentially could have observed it. Also, he reported that at this time he was just starting his YouTube channel, he was just becoming famous, and he was working a crazy schedule and sleeping very poorly, and it's known that severe sleep deprivation can trigger a generalized seizure. So when someone has a seizure, they do not necessarily have epilepsy. So epilepsy essentially means there's something wrong with your brain such that you have a tendency to have have seizures repeatedly, and people with epilepsy, generally speaking, need anti-epileptic drugs to suppress seizures. Whereas when someone has a single seizure that is provoked, in this case perhaps by sleep deprivation, but it could be due to alcohol withdrawal, or it could be due to a medication such as Wellbutrin or bupropion, or certain antibiotics like imipenem antibiotics, or perhaps insulin leading to hypoglycemia, or other illicit drugs perhaps. Those people don't necessarily have epilepsy and they don't necessarily need medication. So someone in this situation with a single provoked generalized seizure generally would not be diagnosed with epilepsy and would not be recommended to take anti-epileptic medication. But of course, it could be a huge hassle because you would have to take precaution. You wouldn't be able to drive for a period. You would not be able to do anything dangerous like climbing high places or swimming alone. And in California, where I practice, we're required to report people to the DMV if they have a seizure, though people can get their license back later on if they're seizure free. Now, brain cysts are very common in the general population. Here's an MRI image showing a left temporal lobe arachnoid cyst. So you're looking at a slice like this through the brain. These are the eyes, these are the optic nerves, these are the internal carotid arteries, this is the basilar artery, and this is the left temporal lobe. So we're looking from the feet up, so this is the left side, and you can see this fluid-filled space. So on T2 sequences, the cerebrospinal fluid looks bright, and this is just a fluid-filled cyst. It's not a tumor. And if you look closely, you can see the gray matter, the surface of the brain, is sort of pushed backwards, and so this lesion is actually outside of the brain. And this finding is well known to be a common and benign incidental finding. Even though it's much larger than Tristan's cyst, we see these all the time, and they're generally speaking not concerning. I actually have a patient who has a massive left hemispheric arachnoid cyst, which takes up nearly 1/3 of the entire left hemisphere, but the rest of her brain, as it developed, was just pushed out of the way, and she has no neurological deficits whatsoever and required no intervention and is doing great. But Tristan's cyst looks a little bit different. So here's the 2020 MRI on the left and the 2022 MRI on the right. And again, we're looking at axial slices like this to give you some orientation. These are the eyes. This is the olfactory area of the brain in the inferior frontal lobe. These are the middle cerebral arteries. These are the posterior cerebral arteries. And this is the midbrain. And here is the right temporal lobe cyst. And you can see it's fairly medial. It's kind of deep within the brain. And by the way, this contralateral lesion is actually a normal structure, a temporal horn of the lateral ventricle. And you can see between the 2022 and 2020 MRIs, it has slightly increased in size just a little bit over 2 years. But the point I'm making is it would be difficult to look at this lesion and be 100% confident that it's benign, but it's very small, and presumably they didn't see any solid components suggesting that it looked like it could be a tumor, and reassured him, but because they couldn't be confident that it's a benign lesion, recommended follow-up MRI scans, which seem to be very reasonable. And one important thing to note is that Tristan Jass is right-handed, and most right-handed people are left brain dominant. Now, you got to be careful. If you're a neurologist and neurosurgeon, you got to make sure you ask people, did you do everything with your right hand? You weren't forced to write with your right hand when you were a child, even if you preferred the left. But people who are truly naturally right-handed, 99.7% of the time, they're left brain dominant for language. Now, if you look at his MRI scans, the left temporal lobe is a very important structure for language, and if you had a significant injury to the left temporal lobe, you could have what's known as receptive or Wernicke's dysphagia, meaning it's difficult to understand language, including written language. So a major injury to the left temporal lobe in a right-handed person could be quite significant. Now, this is a tiny cyst, so regardless of what side it was on, it wouldn't really be expected to cause major symptoms unless perhaps it was causing focal onset epilepsy. But in someone who's going to have brain surgery, that becomes very significant. significant, and I'm sure the neurosurgeons would feel much more comfortable coming into the right temporal lobe than the left temporal lobe in a right-handed person. There's also spatial and memory dominance. Generally speaking, right-handed people also have left temporal lobe dominance for spatial orientation. People with major temporal lobe injuries or surgeries can sometimes have subtle spatial deficits, such as having difficulty with direction and orientation. And also the hippocampus, the medial temporal lobe, has a function in short-term memory, but the risk of having a neurological problem after an operation on the non-dominant temporal lobe is much, much lower. I actually know someone personally who had very severe epilepsy that was arising from the temporal lobe, and they had a procedure called a temporal lobectomy, where part of their temporal lobe was removed, and they had major remission from epilepsy and no longer had to take medications and really had no major neurological deficits, and they were able to return to work, get married, and have children and do relatively well, though after a long-term recovery. And this individual had a very significant intentional injury to the temporal lobe and still did quite well. So that goes to show you really can have an injury to the temporal lobe and have no symptoms. Now let's speculate and say this is a malignant tumor, though it very well may not be. And let's say no intervention were done and it were to grow larger and larger over time. Surprisingly, it could grow much larger and still not cause evident symptoms. But if it became very large, it could potentially affect vision. There's part of the optic radiations that goes through the temporal lobes, and this would control the contralateral superior field of vision. So that would be his left superior visual field, and I've had some patients have some problems where they have a brain tumor and they don't know it, and they're getting into car accidents because they can't see part of their visual field. Or it could spread to the parietal lobe and cause numbness on the left side of the body, or perhaps enlarge and push on the cerebral peduncle and cause weakness of the left side of the body, or even compress the right posterior cerebral artery and cause an infarction of the right occipital cortex and cause loss of vision to the left side. Again, this is all speculative. If this were a malignant tumor and became very large over many years, again, just speculation. And by the way, the original doctor's prediction that the seizure was caused by sleep deprivation appeared to be correct, as he never had a subsequent seizure nor developed epilepsy, and presumably does not need any anti-epileptic medication and has no restrictions, as far as I know, can drive, do anything he wants. However, they continued to surveil the cyst with MRI scans, and it got bigger, unfortunately. So this is the 2023 scan on the left and the 2024 scan, and if you look closely, it's getting a little bit better. And if you look very closely at the cyst on the 2024 scan, it's slightly irregular. It's not perfectly round, and there appear to be some solid component to the cyst. Now, that does not necessarily mean that it's a tumor. Sometimes benign cysts can have a septum. I remember I had one patient many years ago who had a very large left cerebral cyst with a septum. It clearly had a solid component to it, and the person was asymptomatic for many years, and it grew slowly over approximately 15 years, and they eventually did need surgery to remove the cyst, though they did well afterwards, and it actually came back completely benign with no malignant component. So intracerebral cysts can, in rare cases, grow slowly and cause neurological symptoms. That's uncommon, but it can occur. But the point is, looking at this MRI scan, there would be some concern that this is not a benign cyst because it's growing and has some solid component. And this is the 2025 MRI that he released, and the cyst is even larger. It's now 17.2 millimeters, previously measured at 14.2 millimeters. This is the no contrast scan, but with contrast dye, there's this new concerning feature. So this is a T1 scan with gadolinium contrast. Gadolinium is a heavy metal contrast agent region. And what it does is it gets into the blood vessels. For instance, you can see the right posterior cerebral artery. You can see this venous structure here, and it gets into the meninges. But it can also get into active inflammation and breakdown of the blood-brain barrier, and it can also get into tumors and masses because they generally have a high metabolic requirement because they're growing and dividing and tend to take up the contrast dye. So you can see the cyst does not take up the dye, but there seems to be a small enhancing component. And what the neurosurgeon is concerned about is this represents a tiny cystic tumor. So there's a tiny tumor, perhaps growing very slowly over many years, and it happens to be creating a cyst. And so the neurosurgeon is just not confident that this is a benign cyst and now is recommending to have it removed. Another issue is that Tristan is only 25 years old. So imagine he were 80 and it grew slowly over 6 years. And again, even if it grew much larger, it would likely be asymptomatic. But in a 25-year-old, if it continued to grow, you would think it would eventually cause some neurological problems. And perhaps in the future, the surgery would be a higher risk procedure with a greater risk of neurological complications. So they were recommending to go forward with the surgery. Though when I posted this on Twitter, some radiologists were skeptical this is actually a tumor and thought instead it could be a benign lesion. Of course, it's difficult to know by reviewing only a single image. It would be more appropriate to review all the sequences and images, as his own doctors surely did. Now, it's very difficult to speculate on what Tristan's cyst is. It's just an unusual clinical scenario, really not something we see every day. I think you could have 10 neurologists, 10 neurosurgeons, and 10 radiologists, and they would come up with 30 different speculative ideas. It's just very hard to know, but I'll show some examples of different cystic lesions in the brain, and some are benign and some are tumors. And again, these are now not Tristan scans, just some examples of cystic lesions. So this is an MRI scan in a middle-aged person who had the scan for vertigo, and they had this incidental finding. This lesion in the left temporal lobe would not be expected to cause vertigo. And you can see it follows cerebrospinal fluid on all sequences. On T2 sequences, it's bright. On T1 sequences, where the cerebrospinal fluid is dark, it also looks dark. And this is a perivascular space. So around blood vessels, you can get these dilated cerebrospinal fluid-filled spaces, and sometimes they can be very large. They're also known as Virchow-Robin spaces. They're very common on MRI scans, and occasionally they could be gigantic and look like cysts, and this is completely harmless and benign. Here's a perivascular space in the right temporal lobe that looks similar to Tristan scans. It looks like there's a little T2 bright edema around the cyst on this flare lesion, but this is generally speaking a benign lesion. Here's a larger Virchow-Robin space, again a perivascular space, in the left basal ganglia, a common location to find these. I chose these pictures because there seems to be a little bit of contrast dye enhancement, though on this image you can see it's clearly a linear blood vessel and not something which could be a tumor. So perhaps it is possible to have some enhancement of perivascular spaces, though it's really not typical to see any enhancement. Here's a dermoid cyst in someone with headache and dizziness. You can see the main lesion in the temporal lobe and some satellite lesions with a very heterogeneous characteristics, totally different from Tristan's cyst. Here's an MRI scan showing neurocysticercosis, a brain parasite often obtained from eating contaminated pork, though it's rare in people born outside of the United States. Also, they don't typically grow these lesions, and from other sequences of the MRI scan, such as gradient echo, it would be obvious that they're heavily calcified and they would just look completely different. So I don't think it's plausible Tristan could have this condition. Here's a glioependymal cyst in the right basal ganglia. Instead of being covered in arachnoid matter, as in an arachnoid cyst, part of the meninges, the surrounding wall of the cyst is formed by glial and ependymal cells, but they're benign lesions, though they don't usually take up contrast dye. This MRI scan shows a left temporal lobe cystic ganglioglioma. Here you can see the enhancing component is the solid tumor, and the darker region is the surrounding surrounding cysts. These are known to be cystic in some cases and can occur in younger people, though if resected, the prognosis is usually excellent as they're slow growing and usually not very aggressive if they're low in grade. This MRI is in a 28-year-old man with a small right temporal lobe pleomorphic xanthroastrocytoma with a tiny tumor and a cystic component. And this last one is an MRI scan of a 63-year-old woman with headache and blurred vision for 2 years. She has a right hemispheric lesion which has a small enhancing component and a very large cyst, and this ended up being a meningioma, a tumor of the meninges or coverings of the brain. And if you look closely, you can see it does appear to be attached to the meninges. Usually these are solid tumors, but in rare cases they can be cystic. Often they're grade 1, not aggressive, slow growing, and when removed have an excellent prognosis. So I've seen quite a few of Tristan Jass's videos, and he's a super nice guy, very entertaining, has a tremendous passion for the game. He really knows how to come up with new and interesting ideas, and some people think he's not good enough for the NBA, but to be honest, I personally couldn't tell the difference. He looks pretty good to me. I do wish him good luck if he goes forward with the surgery, and of course, I hope everything goes smoothly with no complications, and I think that is likely for a young, healthy person having surgery on the non-dominant temporal lobe, a smaller lesion, not needing a major resection, and I'm sure he's seeing very qualified specialists, and I also wish him the best possible pathologic diagnosis. Of course, best case scenario would be a completely benign lesion like a perivascular space or a glioependymal cyst or something like that, and second best scenario would be a small low-grade mass such as a WHO grade 1 meningioma with a cystic component which is completely resected and surgically cured. You may need to do follow-up MRI scans for surveillance, but no radiation or chemotherapy with a relatively low risk of recurrence. But of course, I hope it's completely benign and we see him back out on the basketball court making entertaining videos very soon. Comments, questions in the notes below.